This is Walt Fritz from Foundations in Manual Therapy Seminars with another evidence for the SLP for manual therapy video here. This time we're looking not at one study, but maybe a group of studies. Posture and posture in a lot of disorders is something that we see frequently in the literature, but also it's kind of the common, simple explanation for problems, but whether it's neck pain, back pain, shoulder pain, etc. But also within the niche of the speech pathologist population, we see some really decent studies you can see here for voice disorders, muscle tension dysphonia, as well as a study on swallowing. And certainly posture is important, but the definition of posture requires us to look a little deeper than just keep it as a simple, if your posture is bad, this is the reason why you're having fill-in-the-blank disorder, which is sort of the common narrative that we hear and see frequently. As you can see on the slide, we've got this is just a small slice of the evidence that talks about these postural concerns and then correlating them to a dysfunction. And yes, when they intervene to improve posture, swallowing, voice, etc., improve. But I think there's a step we need to take look at in between. Does poor posture lead to these issues? And I think that's where things get a little sticky, because there's a lot of people out there in the community with what one might consider not very good posture, usually head alignment or forward head in this case, but have no issues of voice, swallowing, and related issues. And those predictive studies are very rare and probably don't exist to say, if you've got bad posture, this is what's going to happen down the road. We need to really put it all into proper context. The manual therapy has been shown, as you can see on the slide from that Santos slide, to improve posture. But that whole does correlation equal causation is definitely not true. It's also a reference that I make, highly recommended reference, and it's a book. It's a book called Slouch, which really takes a look at the evidence behind the posture panic epidemic, etc., that we seem to be facing right now, as well as trying to balance that in terms of, does posture matter quite as much as we think it does? So the whole point of this video is to just look at that evidence briefly, but also ask you to temper the temptation to, when you see something like poor posture or poor technique, don't immediately go into the blame place with it. Sure, we can work to provide intervention, whether it's behavioral, manual therapy, exercise, to alter a person's posture. But even if we do that, we have to realize that any intervention is multifactorial, and the results are follow in line as well. So hopefully this gives you a little bit more balance when you're dealing with a person's issues and trying to figure out what's the cause. Cause is incredibly complex. We use these studies, but don't overstate their meaning. I'd love for you to watch some more of these videos on this evidence for the SLP series. You can find them on the YouTube channel, as well as on my website, waltfritz.com.